A very good afternoon to all of you. My topic for today's talk is that retinoscopy and refraction should be just optional for postgraduates. As all of us know, cataract is still a very big devil in front of us in the form of 63% of avoidable blindness according to NPCB. And with the increasing life expectancy, it is expected that the elderly population in the age group of more than 60 would almost double by 2050. So this number would outstrip the number of trained ophthalmologists and would keep our cataract surgeons very busy. Now our ultimate goal in public health for ophthalmology is to provide best eye care which is affordable in a system that is self-sustaining. Let us take an example. All of us, most of us are iPhone users here, and if we take a closer look at the box, it says designed by Apple in California and assembled in China. Now what is the use of this? Yes, it would decrease the amount of time required to manufacture that particular phone, maintaining the quality, and in turn would decrease the cost for the consumer. So this principle is called scaling up. Using the same principle of scaling up in ophthalmology fraternity, we can always make use of optometrists who are very well trained in refraction and retinoscopy. These professionals would maintain the quality and decrease time we see per patient, making them more affordable. So for every hour an ophthalmologist spends refracting patients, he could be operating 3 to 4 cataract cases in the light of all the load of cataract which we have today. Now, there are many alternative refraction methods as autorefractometer, which is being widely used. And some studies are coming up according to which a cycloplegic autorefractometer, autorefraction under cycloplegia is as good as retinoscopy. Though good evidence is yet to come, but this would prove very useful. Now there is something called adjustable glasses in which with a swipe of finger, the person can change his focus from distance to near and vice versa. There are many other gadgets which would seem costly at present, but they would pay themselves off in future, just as an ATM machine did in banks. Coming to the postgraduate per se, this little person is overburdened with lots of work from OPD management to we need him to be oriented towards ophthalmological research, everything he's burdened with. And the day-to-day routine list of this person has so much to do that he is left with very little time to learn surgeries, to learn intricate ophthalmological workup. So it is not just refraction which he has to learn. We see that most of the first year and half of the second year is just given to refraction mostly, and we are not making our students learn something which they would very much need, like routine gonioscopy, a peripheral fundus exam, a good strabismus assessment, ROP screenings, and much more. We have mostly we have seen our faculty say that you have to pass the exams and you should at least know how to do refraction, at least know IOP and gonio, at least a fundus biomicroscopy, and basic steps of SICS cataract surgery. So I would like to suggest, let us change our approach to why not. Why not make them learn oculoplasty surgeries, some pediatric cataract surgeries, give them exposure for vitreoretina, and advances in cataract. Actually, our postgraduates, it's a onus on our faculty that our postgraduates, their 2 to 3 years which they got should be judiciously used, and we can always outsource the work of refraction to optometrists and make them better, confident surgeons for our nation. Thank you.
Yeah, thank you, Saumya. Very well put. Do you think is there a conspiracy theory like in the US? I think the optometrists are the very organized lot. They're actually they're bossing over the ophthalmologists, and they're actually tweaking the policies. But in India, they're unorganized and subservient to us. So are we really fearing that we want to keep refraction in our hands and not give it to the expert people, and probably we can use it? That's a point to discuss, because changes are imminent. I think we need to understand, like as she has put, this is probably something to ponder. Like by putting too much of refraction on them and trying to make it a thing, are we really taking their, diverting them from not learning the basic core thing, what they are supposed to do as an ophthalmologist? So this is something that we need to probably answer with time to come. I think people can comment. This is the last topic. I think Dr. Madhu can comment. I know you will not agree.
No, it's not that. It's not agreeing or not agreeing. See, at our place, most of the refractions are done by optometrists. But when it comes to residents, it's a skill That definitely needs to be learnt. There is no doubt about it. Yes, but we cannot use them as a cheap labor to do refraction for all the patients who come to your OPD. The skill they need to learn, because retinoscopy is not only about refraction. There are so many more things that you get out of retinoscopy that a optometrist would miss. You can even get actually truly a detachment. You can get so many things. Corneal aberration, I still remember as a resident, I found a corneal aberration, irregular glow and nothing else, like that. So retinoscopy they should know, because also they should be able to confirm what the optometrist is doing. So they must learn, but yes, we should not be really using them as cheap labor. There's no optometrist, so all the refractions to be done by residents. That would not be fair on them. They should be made to do only what is required for them to learn the skill perfectly.
So we have a Dr. Prakash Marathe from Maharashtra. He wants to just add a few things.
One of the patients, when that patient went to optometrist told that ophthalmologists are made only for surgeries, and we are the people who are specialized in refraction. See, this is a very important comment, what we shouldn't miss. Another thing is the contact lens work. Basically, it has gone from ophthalmologist's hand to optometrist and optician. This shouldn't happen. Basically, we should train those people. That is no doubt about it. There is no doubt about it. But then we shouldn't leave these things like diffraction and contact lens only in their hands. Because that way we'll be leaving our.
It also makes some business sense for ophthalmologists.
Yes, that's true. Thank you.
I think with that we close the session. Thank you very much for all the chairpersons and all the participants and all the audience for making it so live.